Across the globe, health insurance has been known to act as a financial buffer against unplanned, unpredictable, and out-of-pocket medical costs that could otherwise deplete one's emergency fund and savings. Hence, the establishment of the Delta State Contributory Health Scheme to ensure access to affordable and quality healthcare services for all residents of Delta State, irrespective of their socio-economic status and geographical location. The Delta State Governor, Right Honorable Sheriff Oborevwori, in line with this more agenda to bring more dividends of democracy to Deltans, especially in the health sector, swung into action upon assumption of office on May 29, 2023, and appointed two experienced result-oriented achievers, Dr. Austin Obidi as chairman of the Delta State Contributory Health Commission and Dr. Isaac Akpoveta as Director General and Chief Executive Officer, with a mandate to effectively implement, regulate and supervise the Commission so that affordable and quality healthcare would be a reality.
It is therefore imperative that members of the Commission are persons of integrity who will discharge this mandate without bias, prejudice, and sentiment. I am confident that the chairman and members of the Commission meet the above criteria. Dr. Austin Obidi and please sit down, and Dr. Akpoveta of the Delta State Contributory Health Commission are in familiar territory. They are part of the sixth term in the last administration, and therefore well suited to sustain the momentum in our quest for universal coverage, health coverage, as they exhibit probity, transparency, and stability.
Understanding the assignment and poised for excellent delivery, the duo, after their screening and subsequent swearing-in on the 25th of September 2023, hit the ground running by constituting the governing board of the Commission, comprising experienced professionals from key entities, including the Ministries of Health and Economic Planning, the Office of the State Head of Service, the Nigerian Labour Congress NLC, Trade Union Congress TUC, the Civil Society Organization CSO, Nigeria Employers Consultative Association NECA, and the National Health Insurance Health Commission. Today, among other remarkable achievements, the Commission has enrolled over 2 million residents of the state in the Contributory Health Scheme, with emphasis on the indigent and vulnerable members of the society. This has placed Delta State as a front-runner and reference point amongst all states in Nigeria, thanks to the proactive and ever-supportive Governor, Right Honorable Sheriff Oborevwori. As a former lawmaker, the Governor understood the provisions of the Delta State Contributory Health Scheme Law of 2019, which recognizes the vulnerable as pregnant women, children under 5, the elderly over 65 years of age, the physically and mentally challenged, the less privileged, and others. Hence, he consistently provided funds to service their medical expenses in the health facilities of their choice through the equity plan of the Health Commission. Dr. Isaac Akpoveta speaks more on the equity and other health plans of the Commission.
The law created 4 plans: the equity health plan, the informal health plan, the formal health plan, and the private health plan. The equity is actually meant for the vulnerable people, those who cannot really afford to pay the small premium of 7,000 naira, and those who are endangered. For example, pregnant women. All pregnant women in Delta State, from the day you are pregnant till you deliver, either by spontaneous vaginal delivery or by cesarean section, is free, and the government pays for it. Of course, there's no free food in Freetown, so it's free to the enrollee, but the government pays, and that's a huge bill. And the purpose of that to ensure that our indices in maternal mortality is greatly reduced, and no woman pregnant in Delta should die in pregnancy. should have any morbidity in pregnancy. That is one. We also take care of every child from 0 to 5 years, with the critical period where children are prone to deadly illnesses, and of course the old and the challenged, physically and mentally challenged, the equity health plan. For that, we have registered well over 1.7 million Deltans. And then the formal sector has to do with the employees of the public and private organized sector. And that all Deltans who are civil servants, public servants, are already enrolled automatically into the scheme from day one. And then for the organized private sector, a lot of companies, if I say rule in Delta now, before you contract with Delta State, you must register your staff with the commission and have a certificate of clearance before you can do any business with Delta State. And so the organized private sector is coming in. The informal sector have to do with the artisans and every other person that is not in this group I've described. And we are doing a lot to ensure that one comes in. But apart from the basic plans as entrenched in the law also give us the mandate that we can create other initiatives.
Recognizing that most residents of Delta State are either self-employed or not employed by the government, and thus fall under the informal health plan, and driven by a commitment to achieve Sustainable Development Goal 3, universal health coverage for all, various initiatives have been introduced to ensure no Deltan is left behind. One of such initiatives is the Indigent Enrollee Adoption Initiative, which provides opportunity for philanthropists, companies, and organizations to adopt and pay the premiums for a year for the indigents in their localities with just 7,000 naira per person. Since its launch, the initiative has seen over 1,000 indigent Deltans registered, as well-meaning Deltans have embraced the initiative. In Okbe local government area, Mr. Midian Obayamo adopted and purchased health insurance for 100 indigents of Jedo community, thereby improving the health indices there.
The Bible says it's good to do good. Every assistance you can render, you render it.
Oshimle North local government followed suit, with a member representing the area in the State House of Assembly, Honorable Frank Esenwa, purchasing for 400 persons.
It's inevitable, all of us, one way or the other, illness will come. I mean, government alone cannot fund everything. So what we do is like a stopgap. Let us assist one way or the other. And health is sure one of the things that you deserve to have. Once you are healthy, there is hope. I mean, we know things are very, very, very expensive. The government of Delta State is very conscious of that.
In Anyochi North local government, the Organishu Mwobe Kenu Foundation adopted and paid for 100 persons in their community.
Because if you are not healthy, there's nothing you can do in life. So what is the point waiting for somebody to die for you to buy 10 cows to bury him when you can save him with just 7,000 naira per annum? So we are very grateful.
The Urobo Nation also saw their illustrious sons, Honorable John Nani, the chairman of the Delta State Oil Producing Areas Development Commission, the SOPADEC, adopting and purchasing health insurance for 240 women. And Honorable Solomon Irapata, the chairman of the Delta State Board of Internal Revenue, sponsoring 250 women. All the beneficiaries were drawn from the various clans that made up Urobo Nation.
I've been told that other ethnic nationality in Delta State getting the cards, the health insurance scheme, and I know full well that we have vulnerable persons who cannot get this card. So I decided to give for the first phase 10 per each kingdom of the 24 kingdoms in Urobo land. And the 24 kingdom 10 will give you 240. That's what I just did. As time goes on and God helping me, I will do more. And I'm also asking those women in Urobo, women and men, to also contribute to the indigent old women who cannot go to the hospital because of finance.
It's a thing of joy. A healthy nation is a wealthy nation. And in line with His Excellency's dream for Delta State, in his more agenda, he promised Deltans that he's going to do more for them. Meaningful development opportunities for all, enhanced peace and security, and of course, meaningful development. So, in line with that, you can see that there are opportunities for virtually everybody. And what I'm seeing today, it's my own way of complementing what His Excellency is doing, because government cannot do it all. So I need to also show love too to my people.
Moved with compassion are the unique challenges faced by persons with disabilities, and a reaffirmation of his commitment to advocating the rights and dignity of people living with disabilities. Dr. Isaac Akpoveta adopted and paid health insurance premium for 250 persons living with disability, with beneficiaries comprising 10 persons from each of the 25 local government areas of the state.
The meeting today marks a significant moment where we acknowledge the unique challenges faced by persons with disabilities and reaffirm our commitment to ensuring their inclusion, support, and equal opportunities within our society. And I'm happy His Excellency, the former governor and the present governor, like you've just rightly said, is already doing that. I'm not surprised, because they are men of goodwill.
Catching the vision and in support of their DG, directors in the Delta State Contributory Health Commission have keyed into the initiative, with some adopting 10 persons with disabilities and others 5. Apart from the Indigent Enrollee Adoption Initiative, there is also the Artisan Enrollee Inducement Initiative, designed for craftsmen and skilled workers. They also initiated the Tertiary Institution Social Health Insurance Program (TSHIP), aimed at ensuring quality and affordable access to healthcare to students in tertiary institutions in the state. With approximately 8,000 students from the Denis Osadebe University DOU and the University of Delta Amo already registered, and more underway, a significant milestone in healthcare accessibility for students in Delta State has been achieved.
But apart from the basic plans as entrenched in the law also gave us the mandate that we can create other initiatives.
To ensure the enrollees start assessing care immediately after they are registered, the Director General moves with his officials and registration equipment to enroll residents into the scheme and presents them with their health insurance cards on the spot. In all of this, the hard-to-reach areas in Delta State, especially those in the riverine communities, were put into consideration. Hence, the Access to Finance program, a public-private medical partnership which has been running since the inception of the Commission, was sustained. The arrangement, which allows private sector organizations to upgrade, manage and run health facilities in hard-to-reach and underserved communities, has helped provide more access points to healthcare and spread good health in those areas.
It is a good thing that we have health insurance, because it's been able to cater for a lot of people, those that cannot actually afford healthcare out-of-pocket payment. And in spite of the challenges which comes with health insurance, so far it's been good in delivering services to the targeted people. It's meeting their challenge, particularly the children, the pregnant women, and in fact entirely the family. For the patients, it's been doing well, though we know there is need for improvement, particularly on the area of the coverage. We look forward for for more people to come on board. So far for the patients, it's been wonderful, and they have testimony. And because globally health insurance don't cover everything, so even in the Western world, it's not everything they cover. So for the ones that is covered by this scheme, so far the patients have good testimonies. and they are happy.
So far, it's been a good experience because we've been able to meet the health need, most of the health needs of most of the people in Delta State, a large number of people in Delta State, because we know that healthcare is not cheap, especially with the current economic downturn. A lot of people cannot really afford healthcare. So, for instance, you see a pregnant woman who cannot even eat 3 square meals. You tell her to come and pay 300,000 for CS. She really cannot afford that, but with the help of the state government, Asaba Specialist Hospital has been able to offer free maternal care to her patients. In fact, our delivery rate is about 180 per month, and we do about 60 to 7 cesarean sections every month, free of charge. And a lot of indigent people have actually benefited from this, and it has gone a long way to reduce the death among pregnant women and their children too. So I would say that the state government has indeed done very well, because with the scheme and the support, the drugs and all of the things that go with it, as a hospital we've been able to offer care to our patients as at when they need it, and without them having to worry about the financial aspect of the care that they require. For those other sect of people, I really want to encourage them to key in, because it's really good. It helps you to save money, and then nobody budgets for sickness. So when a sudden illness befalls an individual, you know, you have a health insurance backup to fall back on. So in this hospital, I tend to have over 10,000 patients most months, and that's quite a lot of patients, yeah. For the pregnant women who all access free care, we see over 3,000 of them every month, both outpatients and inpatients, minus the children less than 5 years who are also under the scheme. So that means that our bill to the commission is actually very high. Yeah, so what they do is they pay us from time to time, and usually it comes in bulk. So, you know, normally patients come every day, they pay small, you know, your money is building. But when contributory health pays us, the advantage is that we can actually use it to do something capital for the hospital. So you see things like the endoscopy machine that we've bought. It also helped us to buy our x-ray machine. It helped us to do some expansion in the hospital. Indeed, it has do accreditations, which cost lots of money. So because you cannot really get that money in bulk from a day-to-day business that you are running, because patients don't pay in bulk like that. So, but with the Contributory Health Commission, it has really helped us to do a lot in terms of developing the hospital. So it's like a win-win situation.
I love the way they paid attention to us and they served us, and the CS, the way they told us that it's free. I have confirmed it that it's free, that nothing is to be paid. And from the other places I've been, like my first daughter I had by CS, I paid 300,000 at the end of the day after buying so many drugs that I bought in order for them to carry out the services. But here I've seen something different, and I want to thank the government for this wonderful scheme they've provided for.
I think it makes me feel happy. Telling my friends, the people don't know, then they come and register for health insurance.
I was referred here by my friend who gave birth. She said everything is right. At first I did not believe. I said, how possibly it is? So I said, let me just come and try with antenatal. So the first antenatal I came, it was free, registration, everything. Seeing doctors and drugs was free. So I continued till my delivery with CX. And after everything, I did not pay any money. So I'm so happy for the free offer. I'm happy for the governor, what he has done for us. I really appreciate his effort. It's not easy.
Make the country Nigeria be a better place. They will not just be dying like that. At least if they relieve of this, at least they will live no longer.
The success story of the Delta State Contributory Health Commission has attracted different categories of persons and groups to the commission, including the Oborevwori of Oyede Kingdom, His Royal Majesty, Dr. Idiare J.I. and some palace chiefs. The Association of Resident Doctors, Federal Medical Center, Asaba, the Nigerian Medical Association, NMA, Delta State Chapter, as well as proprietors of community newspapers. They all showered encomium. Even when the Delta State House of Assembly Committee on Health visited the commission as part of its oversight functions, the leader of the delegation and chairman of the committee, Honorable Ferguson Onwo, said the committee was satisfied with the robust operational framework and structure of the departments in the commission and promised to address whatever challenge the commission may be grappling with.
We're very happy with what we saw here. The program is on course, and this program needs to be sustained. And we are vowed that we will do all that is possible to ensure that this program is on autocourse. It shall run without hitches. Do it by way of legislation or by way of interface. Any intervention that we need to do to ensure that this program goes on, we will do it.
Little wonder, the Federal University of Petroleum Resources, EFRUN Center for Sustainable Development, decorated the Chairman Governing Board, Dr. Austin Obidi, and the Director General and Chief Executive Officer, Dr. Isaac Aboveta, as SDG Champion and Fellow respectively, and gave them awards in recognition of their commendable contributions towards the actualization of SDG 3, which is to ensure healthy lives and promote well-being for all at all ages. They had this to say.
Contributory health scheme is the major funder of health in the state, and a lot of deleterious effects of climate change and, do we say, environmental degradation, they impact on the health of the people. Prevention, they say, is better than cure.
On health, the SDG 3 is very paramount. It's about you and me, and how to curtail the effect of environmental damage on us, and Delta State is forefront. We are doing that. We have got so many initiatives to ensure that we have the indigent enrollee adoption initiative, where we appeal to people like you have some more money to buy insurance for your neighbor who cannot afford it himself or herself, at just 7,000 naira per year. And I can assure you a lot of people are buying insurance for their people, and I'm happy about that.
Dr. Aboveta and Dr. Obidi, despite these achievements, said more will continue to unfold under Governor Oborevwori's leadership, as the Commission is determined to break all barriers and create a more inclusive healthcare system that caters to the diverse needs of the population.
The Excellency has been wonderful. There is regular phase rehabilitation and maintenance of hospitals. His Excellency the Governor has given us his full support all the way. Like we say in our local parable, the person when Papa send message, now with gumption, the kick door open. He's behind us all the way, including Her Excellency, who I'm sure you know also has this program, You Matter. There is a health part of it. But coming back to the second thing I was mentioning, that if you have this humongous population of enrollees, what do we do? It's very important. It's not an accident that after being chairman of HMB for so many years and being a medical doctor for so many years post-graduation, that Providence and maybe some planning up there brought me here to be the chairman. And we have a DG who is very well versed in insurance matters. So with us and the other 8 members, we insisted that our hospitals, as the Excellency is rehabilitating, re-kitting and re-equipping them, the human touch must come in.
And so that we have gotten this so far means that there have been a strong political will. Political will is not something you can grab and see, but you see the effect. That regularly we get people enrolled in, we got funds to pay for services rendered, we have funds to run the system here, mean that fund is being released to us. And it's only a political willed system that releases funds to an agency. And so that is there. And I wasn't surprised, and I'm not surprised, because the present governor, Right Honorable Sheriff Oborevwori, was the speaker, was a member of House of Assembly when this law was passed. And he has been supporting the system even before he became a governor. I wasn't surprised that when he took over, the goodwill of the former governor, Senator Ifeanyi Okowa, continued. And I will tell you one of the signs of goodwill, political goodwill and force. Reappointing my honorable self from the chairman to go and come and sustain the system. It's a sign that you want the system to survive. Instead of bringing a brand new person, say no, Dr. Povita, come and stabilize the place, come and sustain the place. And so that is very important. It's a sign that he's determined to ensure that this place works. And since I came in, I've been very supportive financially, politically, advice-wise. And so I must thank His Excellency the Governor for his effort to ensure that Deltans, the more agenda is very clear. He wants to do more. Symbolically represented, want to do more for Deltans. And what is more than good health for people?
According to Warren Bennis, an eminent scholar and author, leadership is the capacity to translate a vision into reality. As Right Honorable Sheriff Oborevwori marks 1 year in office as Governor of Delta State, it is evident for all to see how he has proven himself a true leader by bringing into reality his vision of providing more health care for Deltans.